Hello, this is Cecily Henderson with Breast Implant Illness Healing. Today we're going to talk about cancer risks associated with breast implants. Now, on a side note, I am a cancer survivor. I had thyroid cancer for about 6 years and understand the difficulties that others go through with cancer. So, my heart is going to be with you throughout this whole lesson. We will focus on the cancer risks associated with breast implants. We will not discuss the research and causation of breast cancer. Although there may be some who have experienced breast cancer before or after receiving implants, most studies have shown breast implants to be associated with anaplastic large cell lymphoma and rare tumors. My heart and prayers go out to those who are affected by breast cancer. Scientific study. Plastic surgeons defend textured breast implants at 2019 U.S. Food and Drug Administration hearing. Why it is time to reconsider. On May 2, 2019, the FDA heard the harrowing testimonies of women affected by breast implant-associated anaplastic large cell lymphoma. These women left an impression on those attending the recent U.S. Food and Drug Administration hearing. Dr. Adams, lead author of a 2017 study of 42,000 Allergan biocell implants, made a presentation on behalf of textured breast implants. He claimed that following his 14-point plan to improve sterility not only reduced the risk of capsular contracture to less than 1%, but also eliminated the risk of breast implant-associated anaplastic large cell lymphoma. The problem was that Dr. Adams' reference study reported a 2.2 capsular contracture rate, not less than 1%. It is unclear how Adams determined this spectacularly low contracture rate. Adams stated that all 8 surgeons in the study, none of whom had encountered a case of BIA-ALCL, used the 14-point plan. There was no proof whether the 14 points were actually followed for the duration of the study, which invites selection bias. 6 authors were Allergan consultants, including Adams, who stated at the hearing that he had no financial disclosures for his presentation beyond his educational activities. A recent journal disclosure indicated that Dr. Adams is a consultant, advisor, and research coordinator for Allergan and Sientra. According to the ProPublica.org website, Adam received more than $75,000 from Allergan in 2016, the most recent year for which payment data are available. In 2019, the FDA decided against a ban on textured breast implants, even though the testimonies of the victimized women were compelling. Surgeons and physicians fought against the ban because they believed textured implants had a lower capsular contracture rate. Most of the surgeons who participated in this study were on the advisory board for Allergan, which is the company that makes textured breast implants. What Dr. Adams didn't tell the FDA is that he had received over $75,000 from Allergan in 2016. A few months later, the FDA requested that Allergan recall their textured breast implants to protect patients. Draw your own conclusions. Scientific study. Breast cancer after augmentation mammoplasty with silicone gel-filled implant. A case report. Background. Speculation that silicone implants may be linked to increased incidence of breast cancer, other cancers, and connective tissue diseases is a current cause of concern. Adequate data to demonstrate the safety and effectiveness of these devices do not exist. Even though the high incidence of breast cancer after silicone implant mammoplasty is not proven compared to non-augmented women, the augmented women presented with more advanced disease resulting in a poor prognosis. A 47-year-old housewife with a silicone gel-filled implant mammoplasty carried out 10 years ago presented with a palpable painless lump in the right breast. Excision biopsy revealed infiltrated ductal carcinoma, which is cancer. Conclusion: it seems prudent not to recommend augmentation mammoplasty in high-risk patients. For example, those with strong family history of breast cancer, patients with previous contralateral breast cancer, and patients with previous breast biopsy showing significant epithelial hyperplasia, which is lesions. In the light of recent advances in autogenous tissue reconstruction, fat transfer, and the anxiety of silicone implant controversy, TRAM flaps should be considered as an alternative procedure. Discussion. In this study, a woman was found to have breast cancer 10 years after getting breast implants. The researchers could not determine if breast implants caused the cancer, but they concluded many women with breast implants end up having advanced diseases after surgery. It was recommended that high-risk patients with a family history of breast cancer or lesions should not get breast implants. I believe it is important to tell your doctor about your family history if you are looking to get breast augmentation. Scientific study. Breast implant associated tumors. Background. In addition to anaplastic large cell lymphoma, other implant-related tumors have been described for some years. Squamous cell carcinoma and B-cell lymphomas occur in very rare cases. Results. The unexplained pathogenesis, as well as the unclear individual risk profile, is an ongoing source of uncertainty for patients and physicians. The pathogenesis of the tumors is still largely not understood. While BIA-ALCL occurs more frequently with textured breast implants, other tumors were also observed with smooth implants and at other implant sites. There have been 1,130 reported cases of breast implant cancer. There are also women with breast implants who have capsular contracture, cysts, scar tissue, nipple sensitivity, rupture, and fibrosis. It is impossible to know if you will have complication from breast implants, but it is something to consider. Final thoughts. It can feel overwhelming sometimes when trying to make the right decision. Having the knowledge and understanding about breast implants will make a difference in your life and others. Remember, you are amazing. There are healthier options available if you would like to find out more about natural breast augmentation. My goal is to support and empower women. Please contact me at bihealingnow.com if you have any questions. Also, there's more information available below at the links if you would like to do more research. Thank you for joining me today.